have you ever? Vamos a ver, tenemos dos o tres componentes importantes para presentar la pregunta, have you ever? And we have some alternativos también. So, dos palabras y un tiempo verbal. So we've got a verb tense we need to figure out, and we've got a couple of key words también. Let's take a look at what they are. First of all, las dos palabras, alguna vez. Alguna vez is the best way to say, have you ever? And what it literally means is any or some or ever a time. Vez is the word for time. And so you would never, when you're talking about occurrences with patients, not time like hours, but occurrences, you're always going to use vez. You would never use tiempo. That just doesn't work in Spanish. It's only vez. So, alguna vez, and then el tiempo verbal is the perfecto del presente. So the present perfect tense, which is the have you this or have that. I have eaten, I have gone, she has taken, that kind of thing. That's the perfect tense of the verbs. So we're going to take a look at how that goes, and then we'll add a couple more palabras that we can kind of move around how we want. Antes, before, or en el pasado, in the past. Let's take a look at some examples and see how this goes. So, unos ejemplos. Alguna vez, anytime, has seguido, have you followed, una dieta especial antes? So this is, it sounds a little repetitive to say before, also in that frase, but have you ever followed a special diet before? Okay? We can move around the alguna vez to a different part of the phrase or the sentence as well. So, ¿ha tratado dejar de fumar alguna vez en el pasado? Have you tried to stop smoking at any time in the past? See? So, unos ejemplos aquí. So, otro ejemplo aquí. ¿Alguna vez ha lastimado el brazo antes? So, have you ever injured your arm before? Oh, by the way, this brings up a great reminder for me. Thank you to everyone who commented in the Learning Medical Spanish, in this group, in this Facebook group, yesterday, as I said, have you ever finished the sentence for questions for your patient? So thanks for the ideas. This was one here from Molly Lee in Summit County here. So, ¿alguna vez ha lastimado antes? So, have you ever injured this or that before? Okay? Bien. So, how do we form this ha lastimado, ha seguido, ha tratado tense of the verb? Okay? It's the present perfect tense. So, ¿cómo formar el perfecto del presente? First of all, we have to have this a form of the verbo. So, yo he, tú has, él, ella, usted ha, nosotros hemos, ellos, ellas, ustedes han. So this is going to be the first word in that verb phrase. Ha tratado, ha seguido. Okay? Bien. And then we need to get to the past participle of the real verb that we're talking about. So if it's tratar, the verb to try, then it's tratado. And if it's seguir, seguido. There are some irregulars, but there are few. In general, here's how you do it. If it's a verbo AR, like intentar, intentar is sinónimo to tratar. Okay, so we've got tratar and intentar as verbs to try. Intentar goes to intentado. Comer, to eat, comido. Sufrir would then go to sufrido. So AR verbs get ado at the end. ERs and IRs get ido at the end. And so all we're doing is dropping the AR, dropping the ER, dropping the IR, and then adding ado or ido for those two. Bien. So we combine these two together, and here we've got a whole bunch of examples for you based on a few categories of asking these questions. So, have you ever had, in the context of some sort of symptom, condition, or problem, or feeling, right? Okay. Tener would go to tenido, is the verb we're going to have. Sufrir and padecer, These are two verbs that are super common. They're not very English at all. I mean, sufrir is suffer, but we don't really use it in the same context as it's used in Spanish. It's the sense of having something, just like having a condition. So, sufrir de diabetes, padecer del corazón, to have a heart problem. And so, there's not a great translation for those, but they're super common in Español. Great. So, continuamos. So, ¿alguna vez ha tenido? Have you ever had? Here are some things that people put in our list in that Facebook post. Este problema or estos síntomas antes. Have you ever had this problem or these symptoms before? Este tipo de dolor antes. This kind or type of pain before. Un aborto espontáneo, a miscarriage. So, espontáneo, spontaneous, ¿verdad? Un aborto espontáneo, miscarriage. Un aborto provocado, so an abortion. Un parto por cesárea, a C-section. Una enfermedad de transmisión sexual, so STD or STI, ¿verdad? Problemas de visión en el pasado, so vision problems in the past. Bien, and then here we'll have a few examples with sufrir and padecer. ¿Alguna vez ha sufrido or ha padecido de migrañas, migraines, reglas irregulares y o muy dolorosas? So reglas, periods, irregulares, irregular, y o muy dolorosas or very painful, ¿verdad? Ataques de asma attacks. Estreñimiento por más de 3 días. Okay, so I couldn't have invented all these myself because, as you know, I'm not a doctor or nurse or anything like that. So thank you for all your comments in the Facebook group. Bien, continuing with have you ever experienced? You might want to ask the question, have you experienced this or have you experienced that, ¿verdad? And so experienced is what we would call a false cognate into Spanish. Doesn't translate what you would think is the right translation, but I promise you that the verb is experimentar. When you see that, you think experimented, but that's not what it is. It's experienced. So, alguna vez ha experimentado. I promise this is not a typo. It's have you ever experienced, ¿verdad? Este problema antes, this problem before. Dolor de pecho cuando se esfuerza. Chest pain cuando se esfuerza. What's that verb? When you exert yourself. Cuando se esfuerza. Kate from the Facebook group had a workaround. She said, you know what? Usually I don't ask, have you ever? I ask, is this the first time? And so here's Kate's workaround. Es la primera vez que ha experimentado, no sé, experimentado dolor de cabeza or dolor de pecho or whatever the síntoma might be, right? Is it the first time? Here we have vez again as the word for time, right? Es la primera vez que ha experimentado. And Tracy had a variation also from the group, and she wanted to ask not just have you ever, but recently. And so here's a recently variation. So, recientemente ha tenido diarrea o estreñimiento. So recently, have you had? Okay? Gracias to Kate and Tracy for those. Have you ever tried? So, otra, ¿alguna vez ha intentado or ha tratado? We've seen these verbs already today. So, have you ever tried? Alternar compresas frías y compresas calientes. Have you ever tried alternating hot and cold compresses or hot and cold packs? ¿Alguna vez ha intentado tomar un medicamento para ayudarle a dormir? Have you ever tried taking a medication to help you sleep? Tomar un medicamento para el dolor. Have you ever tried a pain medication? See? ¿Alguna vez ha tratado dejar de fumar? Have you ever tried to stop smoking? Dejar de is a good verb for you to keep in mind. It's the verb you'll use for stopping any vice or any of those bad habits. So, drinking, smoking, doing drugs, whatever. See? Dejar de. Dejar de tomar bebidas alcohólicas. ¿Alguna vez ha tomado So have you ever taken, so sometimes when you say, have you tried this or that, what you really mean is, have you taken this or that, right? ¿Alguna vez ha tomado drogas recreativas, recreational drugs? ¿Alguna vez ha tomado drogas por vena, so IV drugs, ¿sí? Bien. Have you ever been, could be another kind of common question or phrase you might be asking your patients. ¿Alguna vez ha estado embarazada? That does not mean embarrassed, it means pregnant, embarazada. ¿Alguna vez ha estado embarazada? En tanto dolor que no pudo hacer nada. So, ¿alguna vez ha estado, have you ever been in so much pain that you couldn't do anything? Tan asustada or nervioso or nerviosa, so afraid or nervous that you couldn't cumplir con sus responsabilidades. You couldn't keep up with, or you couldn't do, or what's cumplir? You couldn't complete your responsibilities, basically. ¿Sí? ¿Alguna vez ha estado hospitalizado por el dolor or por esta condición? Have you ever been hospitalized, por here, because of el dolor or la condición, esta condición, this condition? Expuesto a tuberculosis. Have you ever been exposed to TB, tuberculosis? And sometimes when we talk about have you ever been, you might be thinking about traveling somewhere. And thanks to Teresa in your comments here. So, ¿alguna vez ha viajado fuera del país? Have you traveled outside the country? Or maybe this time you switch up alguna vez with the previous variation and put recently, recientemente. Recientemente ha viajado fuera del país. Or recientemente ha viajado a un país or lugar trópico, to a tropical country or tropical place, ¿verdad? All right. Have you ever been told that, trying to get back to, previous, diagnoses or visits to the doctor, etc.? ¿Alguna vez le han dicho que? And so this is a little more active construction than this one. This is technically passive voice, you have been told. But here it's, they have told you. So we're not defining who they is, but it's telling you, le, usted. ¿Alguna vez le han dicho que? Have they ever told you that? And they, sort of in context, assuming that it's healthcare community. ¿Alguna vez le han dicho que padece del corazón? That you have heart problems. Que tiene azúcar alto? That you've got high blood sugar. Que tiene una enfermedad infecciosa? That you have an infectious disease, ¿verdad? ¿Alguna vez le han dicho que tiene una enfermedad de transmisión sexual? Have they ever told you that you have an STI or STD? ¿Alguna vez le han dicho que toma demasiado? That you drink too much. So demasiado is too much in a overdose kind of context, right? Okay, demasiado. Bien, have you ever had, as far as a procedure? So previously we did have you ever had as far as a symptom, but now we'll look at have you ever had in a procedure context. So alguna vez le han hecho, and what we're really saying is, have they ever done to you? And so it's not an exact translation of have you had this or that procedure, it's have they done to you, ¿verdad? ¿Alguna vez le han hecho una broncoscopia? A bronchoscope, ¿verdad? Bronchoscopy, ¿sí? Un contraste yodado. And yodo's iodine. So iodinated contrast, see? That was another comment in our Facebook group, but I definitely had to look that one up. Una prueba de sangre, a blood test. Una prueba de alergias, an allergy test. Un tatuaje, so not from the healthcare community, but just kind of out in society, un tatuaje, a tattoo, see? ¿Alguna vez le han dado? Have they ever given you which would be sort of equivalent to, have you ever required this or that other kind of treatment, right? So, ¿alguna vez le han dado prednisona? Have you ever been given prednisone? Un tubo para respirar, breathing tube, ¿verdad? Okay, moving into a little bit some of the conversations that Kristen and I were having, which initially sparked this topic around mental health. So, have you ever seen or heard? So, vamos a ver, ¿alguna vez ha visto? Have you ever seen manchas que flotan? Now, this one's just ocular. It's not to do with mental health. Have you ever seen floating spots, right? Puntos or destellos de luz flotadores. So, any light spots, like floating points of light, ¿verdad? Here we go with mental health. Cosas que otras personas no pueden ver, things that other people can't see. Okay? ¿Alguna vez ha escuchado? Have you ever heard? Again, just de los oídos, zumbido en los oídos, ringing or buzzing in your ears. And you might say, Rory, it's not the same, ringing and buzzing. In Espanol, there aren't as many words. You could say tinnitus for ringing, but it's kind of a higher register. It's a pretty clinical word to say tinnitus. You might just stick with zumbido if you have to ask about ringing or buzzing. Voces. ¿Alguna vez ha escuchado voces? Voices. And continuing with our mental health, voces que otras personas no pueden escuchar. So voices that other people can't hear. Okay? Bien. Have you ever thought about, ¿alguna vez ha pensado en lastimarse? Lastimar is a verb to harm. So when it's reflexive, it's harm yourself. Lastimarse. Lastimar a otras personas. Harm other people. Quitarse la vida. Quitarse is to take away, right? Quitarse la vida, so to take your life, or suicidarse, see? Commit suicide. Back to lighter topics. Cambiar su estilo de vida, change your lifestyle, see? Cambiar su dieta, change your diet, okay? So, have you ever thought about? We've just gone through a ton of have you evers. And if you didn't already see the link in the Facebook group, make sure you download the slide deck of notes here so that you can have everything printed out for you, easy to access and remember. But now, I have a alguna vez question for you. ¿Alguna vez ha pensado en inmersión? Immersión truly is the best way to learn Espanol. And if you were to choose to work with Common Ground, I'd get the chance to work with you, and I would love that. Our next program is this summer, starting June 29th, and we'll go through the month of July. Some folks will go into August as well for those longer programs. But anyway, would love to have the opportunity to work with you if you're feeling like immersion is, if it's the right time for you to do that this summer in 2019. Okay, well, muchas gracias por aprender español conmigo. Thanks for being a part of our community. Para más oportunidades con español, head over to the website, commongroundinternational.com, and nos vemos el próximo viernes. Adiós. Thank you for joining me today on this Video Viernes lesson. I wanted to invite you to join our community if you're not a member of the Facebook group already, that I deliver these live lessons in on most every Friday. And also point you to the website where you can find a bunch more information about medical Spanish, whether that be courses or free materials for you, or finding a private tutor to work with you online or face-to-face. And also let you know about some amazing Spanish immersion programs, either you as a medical person or your significant other as working in some other industry, or your family. If you want to improve your Spanish and you have time and budget to go do some travel, our programs are pretty amazing. I think it'd be fun to work with you. And finally, if you have some document work at your clinic or at your hospital or within your setting that needs to be professionally translated, shoot me a message, upload your document to us, and we can get you a quick quote and help you out with your Spanish language documents as well. Have a great day.